Hello, my name is Hailey Allen, and this is my presentation for case study number 1. So the client we'll be discussing today is a parent-led client, so I just wanted to go a little bit into what that is because I know parent-led is relatively new in the field. So basically what I do as a program supervisor is I train parents on the interventions we would normally train like BTs or BIs or RBTs on. And the parent essentially is the BI and the BT and collects the data. So we do try to keep things very, very simple, straightforward, and kind of give a lot of explanation to what we're doing so that parents can understand the importance of following the intervention. So now I'm going to go into a little bit about who the client is. So I'll be referring to the client from here on out because I don't want to, give out the name. But the client is 5 years old, diagnosed with autism spectrum disorder. Also, within their file, there is a report of speech delays. So I did want to note here that vocal ability is very limited. We do get 1 to 2 word utterances, but not usually when the client is in distress. So speech therapy, we had a collab and they've been working on one word mands and then also using American Sign Language or ASL to communicate to caregivers what the client needs. Next, we'll discuss the behavior of concern. So there's kind of 2 in 1 here. I did want to separate them out. So what we do see is when we're doing work, or even just simple tasks, even just fun little activities that we want mom to kind of try with us, we do see some tantrums. They usually range about 2 to 7 minutes. It looks like screaming, crying, throwing themselves on the floor, sometimes throwing themselves on the couch. We also see some elopement, so we don't consider it dangerous. It has not gone to the point at all where he is trying to leave out of the apartment or anything like that. But he is leaving the work area and kind of just like running away. So what we did have parent do is take ABC data. So within the app that the parent uses, they're taking data on antecedent, behavior, and consequence and kind of what's going on at that time. And then we use that and observation to kind of do a functional behavior assessment. It turns out a lot of the behavior, some of it was for attention, but most of it was for escape through the ABC data. So keep that in mind as we kind of go through the interventions also later. Next, we'll discuss the obstacles. So obviously we discussed how he had limited vocal ability. So when he's escalated, he has difficulty using vocal mands. So we knew, okay, this might be a difficulty getting him to request for like a break or anything like that. And then also, these behaviors are unintentionally reinforced by caregivers. So when a client was getting up from the little table that he works on and leaving, parents were kind of saying, oh, you want a break? Okay, go ahead. So that was kind of the negative reinforcement. So he was able to kind of escape the work that he was doing. And parents are reinforcing that by kind of letting him go and do that. So with our intervention that I'm going to talk about next, we wanted to kind of target giving him the same need of escaping and having that break, but in a more functional way that we can reinforce. So for our intervention, we really wanted to focus on FCT or functional communication training. What we wanted to do was teach him to request cessation by asking for a break. So eventually in break can be turned into like, I want break or I want need break. But right now we were just going to require break. Through observation, as I kind of talked about before, we noticed that when he's really like escalated or needs a break and really wants to escape the task, he is just not going to say break. So what we did is we kind of changed the communication modality to signing for a break. And I included a picture here of what the break sign is just to kind of show. And also it was very, very simple to teach this intervention because this client has a super high imitation ability. Any fine motor imitation, any gross motor imitation, he is able to do. Next, we'll kind of talk about reinforcement. So his motivating operation or MO was usually to just go lay on the couch. For his breaks, he didn't really want to play with toys or anything. He just wanted to get away from that work or that demand we were placing on him. I did have caregivers start with an FR1 schedule of reinforcement. So every time he asked for a break with that sign, we gave him access to a break. I told mom, obviously in those situations where it's like, oh, we cannot right now, like if it's like a doctor's appointment or something, we'll kind of work through that. But for everything else, give him a break as soon as he asks and give him big reinforcement. And really nice behavior specific. Oh, I love how you asked for a break. That was good using your signs. And then we did plan to fade with slight delays. So by saying like, okay, in 1 minute you can have a break or things like that. That was our main goal. With generalization and maintenance next, we generalize with dad as mom is usually the one who works with us and works on the goals. He currently does not go to school, and there's not really any other adults present like grandparents or anything like that, so we just use the other parent present. And then maintenance, we ask caregivers to take data on this skill once per week, just to make sure he was keeping this skill and not kind of like him and caregivers were not falling by the wayside and not really using the skill that we taught. So this is working very well. We're currently taking maintenance data. And the overall outcome, the client is using the break sign prior to tantruming or elopement, which is really, really what we want. We see now that he will sign break, and then oftentimes he'll also say break, just from mom being like, oh, break, break, and kind of labeling that for him. So now he's echoing the vocal response too. So we'll probably be targeting that next as well. He also tolerates when mom uses delay. So like 1 more question or 2 more questions or 3 more questions. He's able to tolerate waiting for his break. And then we do have a waiting goal that we've added next that kind of goes along with this. So when he requests break or really any item or anything like that, we are targeting first 1 minute and then 2 minutes. So that when he says, oh, I want a break, mom would say, okay, 2 minutes, set the timer and kind of have him wait for the break and then he can earn it. So overall, this treatment and this intervention worked really, really well for this client. I feel like we were able to use his abilities in imitation to slowly teach this skill of using the sign language. And now it's also increasing his vocal language to say break. And I think any opportunity there is to increase opportunities for mans is really, really important, because I know we really need to give him that, like, oh, you asked, so now you're getting that, and he's understanding that through this intervention that we've used. And lastly, I used Cooper just to kind of define what negative reinforcement was, and I hope you really enjoyed this case study. Thank you so much for watching.